Are you okay?
I don't know. I just started having this weird burning sensation in my chest.
Are you having a heart attack?
I don't know. I don't think so.
Have you or your loved ones ever experienced heartburn or acid reflux? If so, you need Nexium. Nexium is America's #1 over-the-counter doctor-recommended medication for heartburn relief. Nexium may also be found under the generic name esomeprazole. Esomeprazole is a protein pump inhibitor, or PPI. PPIs work by turning off some of the pumps in your stomach that create acid. Nexium may take 1 to 4 days to kick in, but result in a full 24 hours of relief. If you suffer from GERD, ulcers, and other stomach acid-related conditions like erosive esophagitis or Zollinger-Ellison syndrome, then you need Nexium.
What are you feeling?
My chest just started to hurt, and I can taste the food in the back of my throat. But with acid, it hurts to swallow. It feels like the acid is just irritating my throat.
Oh, I think you have GERD or heartburn. Have you tried Nexium? Oh, I have the same exact symptoms when I eat, and this is the medication I use.
Nexium, huh? Will that work for me?
It could.
But don't I have to see a doctor to get a prescription?
So not necessarily. When I started the Nexium regimen, the FDA approved 20 milligrams over-the-counter medication in 2014.
20 milligrams? What if I need something stronger?
Something stronger?
Yeah, this has been going on for a while, and antacid's just not cutting it.
Maybe you should see a doctor to see what's up.
Hello, Melanie. I'm your telehealth nurse, Angelica. It looks like your doctor's prescribed you with Nexium.
Yeah, she did, but I still don't understand how it will help me.
So you'd say you have deficient knowledge related to insufficient information about your disease, evidenced by expressions of uncertainty?
That's a long way of saying it. But yeah, can you go over it with me again?
Of course, I'd be happy to help you become more knowledgeable about GERD and how Nexium works to control it. First, could you tell me what you already know?
I know that my GERD is because the stuff of my stomach is refluxing back of my esophagus. The stomach is full of acid, and that's why the stuff that comes back up irritates my throat, and it tastes like that.
That's right. Nexium, whose active ingredient is esomeprazole, is a proton pump inhibitor, or PPI. In layman's terms, it keeps the cells in your stomach from making more stomach acid.
What kind of stuff should I be aware of when taking Nexium?
Ava, sorry to bother you.
Not a problem. That's what I'm here for. Angela, what's up?
Could you help me out with a nursing care plan for this GERD patient? The doctor prescribed her with Nexium and wants me to follow up with her in a telehealth meeting. I have one Nanda in mind, but could you help me with the rest?
Sure. What's your nursing diagnosis?
Deficient knowledge. It seemed like a good place to start.
I'm sure she'll have lots of questions since she's starting a new drug regimen.
How does deficient knowledge related to lack of information sound?
That sounds great. Just don't forget to add the as evidence by part. She'll probably ask for more information or sound unsure. What about the goal?
The patient will have more knowledge on her disease and the medication by the end of the meeting.
That's great. What kind of interventions do you have in mind?
I was thinking I would assess her knowledge so that I have an understanding of where she needs more knowledge by asking what she already knows. Once I know that, it'll give me plenty of direction on what I can teach her, such as eating smaller, blander meals, avoiding foods that increase stomach acid production, such as spicy foods and citrus, and how she should take her Nexium 1 hour before meals, because food can interfere with its action. To evaluate, I can ask her to teach back what she learned and schedule a follow-up in 14 days.
Sounds like you've got most of it covered already. Be sure to monitor the patient for bone fractures because this medication has been associated with an increased risk of osteoporosis-related fractures of the hip, spine, and wrist. Also, be sure to monitor the patient's magnesium levels as esomeprazole can increase the risk of hypomagnesemia. And don't forget to monitor for diarrhea because esomeprazole can increase the risk of Clostridium difficile associated diarrhea. Sounds like you've got most of it covered already. Be sure to monitor the patient for bone fractures because this medication has been associated with an increased risk of osteoporosis-related fractures of the hip, spine, and wrist. And be sure to monitor the patient for magnesium levels because esomeprazole can increase the risk of hypomagnesemia. And also make sure to monitor for diarrhea because esomeprazole can increase the risk of Clostridium difficile associated diarrhea. And don't forget to remind the patient to contact her provider if she develops abdominal pain, diarrhea, and fever that doesn't improve, and to report any adverse reactions to this medication.
Effects include headache, diarrhea, nausea, flatulence, gas, abdominal pain, and somnolence, constipation, and dry mouth. Do not take Nexium if you are pregnant or nursing, allergic to esomeprazole magnesium or any of the other drug's active ingredients, or if you have had an allergic reaction to any PPI in the past. Use increased risk of kidney disease, stroke, heart attacks, gastric cancer, esophageal cancer, and bone fractures. Long-term use of Nexium can also lead to kidney failure, vitamin B12 deficiency, low levels of magnesium, Clostridium difficile-associated diarrhea, and bone fractures. Nexium for esomeprazole can increase the risk of death. Do not use Nexium 24 for more than 14 days in a row, never more than 3 14-day courses a year. Do not take Nexium if they take certain other medications. They should also avoid Nexium if they take certain dietary supplements. Talk to your doctor to determine if Nexium is right for you. If your doctor experiences dry pain or develop a rash on your cheek or arm that worsens in sunlight.
Also, make sure that after eating, you should try to stay upright for 1 to 2 hours so that what you eat is less likely to reflux back into your esophagus. Let the doctor know if you experience any adverse effects, side effects, or if your symptoms persist or worsen.
Okay, thank you.
So it's been a while since we've got something to eat. Did you go to the doctor?
Yes, I did.
How's it working for you?
I've been seeing it for a few weeks now, and I've noticed a big difference. I didn't realize the acid from the GERD was eating up my esophagus. The doctor said it's been healing after taking Nexium.
That's great. I'm glad it's working out for you.
Yeah, thanks for telling me about it.